The cardiopulmonary resuscitation is done when the person encountered, after checking the safety, does not breathe. We analyze the state with our eyes and we check if the person is capable to be resuscitated. For example, in such dangerous environments, and if the person is visibly dead for many days, we don't approach for CPR. If we see criminal stage, if we see criminal scene going on, we don't approach. Performing the CPR is being done accordingly to the type of the person, including adult, a child above 1 year old, or the infant. CPR of the adult does not differ much from the CPR of the child. The only thing we should remember is the depth of the chest compressions. In case of the adult, we talk about 2 to 2.4 inches, which is about 5 to 6 centimeters minimum. In case of the child above the 1 year, we remember to do at least 4 centimeters. And about infant, we remember to check 1/3 of the diameter anterior, posterior of the chest. The speed of chest compression is exactly the same. The procedures and algorithms, they don't differ much, except in case of the child, in case of the infant as well, the procedure varies according to if there is 1 rescuer or 2 rescuers. If there is 1 rescuer, we do the ratio 30 to 2, like exactly the same to the adult. If there is 2 or more rescuers, we do 15 to 2. It means 15 chest compressions and 2 rescue breaths.